House Resolution 500, the gentleman from New York, Mr. Engel, and a member opposed. Each will control 5 minutes. The chair recognizes the gentleman from New York.
Thank you, Mr. Chairman. Let me start by thanking my colleagues and fellow co-chairs of the House Tuberculosis Elimination Caucus, Mr. Young of Alaska, Mr. Gene Green of Texas. I'm grateful for their support of this measure and for their work to combat tuberculosis around the world. This bipartisan amendment would help move that work forward. Mr. Chairman, America's investments in global health are not handouts. Combating disease around the world isn't just some pet project to make us feel good about ourselves. When we invest in global health, we're investing in our own security and leadership on the global stage. After all, infectious diseases don't respect borders, and when we fail to fight a dangerous illness or respond to a pandemic overseas, we risk having to respond once it reaches our shores. At the same time, healthier communities are more productive, more stable communities. Healthier countries are stronger partners on the world stage. And when the United States helps to advance those conditions, we're showing the world what kind of country we are, what American values demand of us. The reality is we should be investing more in these efforts, and one area where we need a lot more support is in the fight against tuberculosis. TB kills more people worldwide than any other infectious disease. This is especially heartbreaking, Mr. Chairman, because we know how to prevent TB and we know how to cure it. So we know how to cure it. People are still dying. That's just unfathomable. Yet in 2015, 1.8 million people died from this disease. 10.5 million more became infected. 1 in 10 TB patients is also HIV positive, making tuberculosis the top killer of people living with HIV. And countries with a high prevalence of TB can see their GDP shrink by 4 to 7%. The World Health Organization tells us we need an additional $2 billion every year to control tuberculosis. My amendment would help to make up part of that shortfall, ramping up USAID's global health programs by $209 million. That would bring our investment in TB assistance to $450 million. These efforts have a proven track record, Mr. Chairman. In the countries where we're working on the problem, incidence of TB has dropped by nearly a fifth since the year 2000, more than twice as fast as countries where we haven't been involved. That's tens of thousands of precious lives saved, and we played a major role in that. My amendment won't wipe out this disease, Mr. Chairman, but it will save lives. It will build on past successes and move us in the direction of putting a stop to this killer once and for all. I ask all members to support this bipartisan amendment, and I reserve the balance of my time.
The gentleman reserves for purposes